Good morning, this is Dr. Fletcher with your Monday Motivation. Today I'm going to talk a little bit about thyroid hormone and hypothyroidism and the interplay with stress. Hypothyroidism is one of the most common disorders. In fact, up to about 12 to 15% of women will experience hypothyroidism, and some in men too. And prescription medicine for levothyroxine, the generic of Thyroid, is the third most commonly prescribed drug in this country. So thyroid is very common. In fact, some of you listening may actually have already been diagnosed with hypothyroidism, and some of the others of you may feel like you have all of the symptoms, but nobody can diagnose you. So what's going on? Well, today I want to touch a little bit about the impact of stress, which we are all always exposed to, and its interplay with thyroid hormone. What we do know is that the hormone that's released when you're stressed, called cortisol, can impair the production of your thyroid hormone. We can also see with cortisol being high an impairment in conversion of T4 to T3, which is the bioavailable form of your thyroid hormone. High stress can also impact your immune function, which we know is a trigger for autoimmune thyroid issues. And it can also trigger thyroid storm, which is an overproduction of thyroid hormone in people who have Graves' disease. So there are a lot of things going on between stress and cortisol. And people who have hypothyroidism may also feel fatigued and foggy thinking, and there's just such a lot of gray zone and common symptoms between these things. So it's important to test all of those hormones as well as your cortisol. So why am I talking about this? Well, one of the most important things you can do if you think you have a thyroid issue or you have hypothyroidism is to address your stress. And that can include things like diet, meditation, and sleep, but also certain types of exercises like yoga. We are going to be doing a workshop with yoga, and the reason why yoga has been shown to be helpful for thyroid is because it also addresses your stress. So we do things like focusing on certain breathing patterns, meditation, certain yoga poses like camel and fish, and even child's posture that can help stretch the thyroid and also improve blood flow. So there's a lot of kind of similarities with these two conditions, but we know that yoga can be very helpful for managing your thyroid. So a lot to go on here about thyroid, stress, cortisol. I'll also be doing a little talk after the yoga session, so I welcome you to join us and learn a little bit more. I hope you have a great week.